Hi, my name is Sabrina Lira, and I'm doing assignment 4 for surgical instrumental. And my slideshow is about cholecystectomy, surgical removal of the gallbladder. Introduction to cholecystectomy is a surgical procedure to remove the gallbladder, usually performed to treat gallstones or diseases of the gallbladder. Indications: on systematic gallstones, cholecystitis usually has inflammation of the gallbladder, pancreatitis, or biliary dyskineria. Anatomies involve gallbladder, cyst, duct, cystic artery, and common bile duct. Surgical approach: laparoscopic cholecystectomy involves minimally invasive, multiple small incisions, and shorter recovery time. Open cholecystectomy involves larger abdominal incisions and used when laparoscopic approach is not feasible. Instrument 1. Kosher forceps. Category: hemostatic forceps. Its functions: grabs heavy tissues or clamps large blood vessels, efficiently controlling blood during surgical procedures. Usage in cholecystectomy: clamps the cystic artery and duct to control bleeding. Inspection point: checks for any chips, crack, or wears on the serrations and teeth. Ensure the ratchet locks securely and release smoothly. Instrument 2. Kelly clamp. Its category: clamping and occluding. Its functions: temporarily occluded blood vessels or tissue. Usage in cholecystectomy: clamps the cystic duct and artery before division. Inspection points: checks for alignments and smooth action of the jaw. Babcock forceps. Its category: grasping/holding. Function: holds delicate tissues without causing traumas. Usage in cholecystectomy: grabs the gallbladder for retraction. Inspection points: verifies the tips are intact and locking mechanism function properly. Instrument 4. Yanker suction. Category: surgical suction instrument. Its functions is to fluid and debris from surgical sites or body cavities. Usage in cholecystectomy: maintains visibility of the critical structures such as the cystic ducts and the artery. Inspection points: tubing connections, suction points, and handle conditions. And this is an additional instrument called surgical stapler, which I do not have, but I like to add it on. Its category: stapling. Its function: apply staples to tissue to closure. Usage in cholecystectomy: secures the cystic ducts and artery before division. Inspection: confirms staples cartridge is correctly loaded and staples fire properly. Surgical procedure overview. Preparation: patient is positioned spine and the abdominal is prepped and draped. 2. Incision. Small incisions are made for laparoscopic instruments. 3. Dissections. Identify and dissect the cystic ducts and arteries. 4. Division. Use electric cautery to divide the cystic structure. 5. Removal. Extract the gallbladder through one of the incisions. And is lastly 6. Closure. Close the incision with structures or staples. Postoperative care. 1. Monitor vital signs and surgical sites. 2. Manage pain using prescribed medication. 3. Encourage early ablation to prevent complications. 4. Provide dietary instructions as tolerated. Instrument maintenance and inspections. General guidance. Clean instruments immediately after use. Inspect for damage or wear. Ensure proper sterilization before reuse. And specific consideration. Electrocardiography. Check for proper functions and cleanliness. Clamps and forceps. Inspect the jaw lines and smooth operations. And lastly, surgical stapler. Verify the stapler cartridge and firing mechanism. In conclusion, cholecystectomy is common surgical procedures that requires precise instrumentation and techniques. Proper maintenance and inspection of the instruments are essential for ensuring patient safety and achieving a successful outcome.